We'd like to welcome to the program Dr. Michael Warren from the Tennessee Department of Health. So nice to visit with you today.
Thanks, you as well.
Let's talk about a definition, if you don't mind, just to start the conversation off. Tell everybody what infant mortality is.
So when we talk about infant mortality, we mean the death of a baby before that first year of life is complete. So from any time from birth on through day 364.
How are we doing as far as this is concerned as a state?
So I think it's important to note we're a lot better than we used to be. So we've made tremendous progress. We've reduced infant mortality by about 15% over the past 5 years in Tennessee. We're a long way from where we'd like to be. So on average, about 7 babies out of every 1,000 born in Tennessee die before reaching their first birthday. And if you translate that into real numbers, it's about 540 babies a year that die before reaching their first birthday. And that's higher than the national average. And we know in some populations, particularly African Americans, that number is even higher. So we've got a long way to go.
Yeah, I was going to ask you, where do we compare when we're talking national statistics and even internationally?
So we tend to be in the bottom 5 nationally. It's not a place we want to be. We'd like to be in the top 10. So we've got a long way to go there. And if you compare, if Tennessee were a country and you were to compare us with other countries in the world, we would rank with countries that you typically think about as being developing countries, not ones with very good health rankings overall. So a lot of opportunity for improvement.
All right. What are the risk factors, Dr. Warren, that contribute to this devastating outcome?
Well, we know in Tennessee that when babies are born premature or at low birth weight, those are the main drivers of infant mortality in our state. And we have a large number of babies that are born that way every year. So that's a big driver. But we also know that some things that happen after the delivery can have an impact as well. So about 20% of all our infant deaths are due to unsafe sleep practices. Things like bed sharing or putting a baby down to sleep on its stomach or with lots of blankets and things in the crib. So those are absolutely preventable deaths and right now contribute in a large way to our infant mortality rate.
Yeah, you know, I know, a lot of women, when they first have a child, especially their first child, that bonding time that you want with them, the co-sleeping as you were talking about, even wanting to get sleep when you're sleep deprived and maybe have baby sleep on their belly for the reasons that they may sleep better. But I know your strongest message is to say don't do that and keep them on their back. Sudden infant death syndrome, we've heard of it many times, SIDS. Explain a little bit more about what that is, please.
So technically when we talk about SIDS, what we mean is a death of an infant, and we've done an autopsy, we've done a medical record review, we've done a death scene investigation, and we don't have an answer for why that child died. And for many years, deaths that occurred while babies were sleeping were labeled SIDS. And as we've gotten smarter about death scene investigation and asking those really important questions when these kind of unfortunate events happen, we've learned that there is an explanation many times. So for example, the baby may have been in the bed with an adult or with another child and someone actually rolled over and suffocated the child. Or perhaps the baby was in their own crib, but there were blankets or stuffed animals or things that actually suffocated the baby. So those wouldn't be called SIDS. That death would be due to suffocation or strangulation. And so even though SIDS cases have gone down, some of that is because we've gotten smarter about terminology, and the number of those deaths due to other unsafe sleep factors has actually remained quite high.
Yeah, so no matter if you think that this will be good for the baby or good for me, it's probably best just to err on the side of safety and caution, obviously.
You know, that first period of new parenthood, those first few weeks and months, folks are absolutely exhausted, and I've seen new parents in clinic, and they're doing as good as they can just to get to clinic sometimes. It's really tiring.
Sure.
And we think, if I could just get a good night's sleep, and what we think, well, if the baby would just sleep through the night, and brand new babies just don't sleep that way. They, 2 or 3 hours and then they're up, and part of that has to do with, their little stomachs don't hold very much food, and they wake up because it's time to eat again, and that's normal. But what we think about is what's good sleep for us may not necessarily be good sleep for the baby.
Absolutely. All right. Recently, Tennessee began a new campaign. It is called the ABCs of Safe Sleep. So can you kind of walk us through that, or just tell us a little bit about it, please?
Sure. So we know that many of the sleep-related infant deaths that we have are due to a very small set of risk factors, things like babies sleeping on their stomach, babies sleeping with someone else, or babies sleeping in a crib with unsafe items such as extra blankets or stuffed animals. So that ABC message really helps keep it very simple for not only for parents, but other caregivers, grandparents, child care providers, anyone who's going to be involved with that baby. And the ABCs stand for babies should sleep alone, on their back, and in a crib. And it's as simple as ABC, easy for folks to remember, easy for folks to share with anybody who's going to be caring for that baby.
How do you get that message across to, let's say, grandma or grandpa? Because I know it was different, when they raised their children. There weren't these guidelines. There weren't these safety measures in place. How is that convincing? How does that go for so many of them?
I'll tell you, it's really hard. When I was a brand new pediatrician, the person I worried most about convincing was grandma, because that's who mom or dad is going to go to for advice.
That's right.
And so the way I always tried to spin that was, our medical knowledge and science is advancing all the time, and we learn new things. So, many years ago, we didn't know that kids should ride in car seats. And in fact, Tennessee was the first state in the country to have child safety seat laws. But prior to the 1970s, we didn't do that. And it was normal to ride down the street and not see kids in car seats. Right now, if we see that, we have this very visceral reaction to that's not right. And so we have that reaction because we've learned that there's a safer way to do it. And so I like to bring that in and have that conversation with families and say, we did that before, we didn't know any better. We know better now, and so we need to change the way we behave.
That's excellent, to be able to give an example of something else that's come a long way, too.
Right.
It's just kind of, everybody's got to be on the same page, right? What are some of the easiest practices, Dr. Warren, to minimize the risk of infant mortality?
So if we think about infant mortality broadly, we've talked about some of those safe sleep practices.
Sure.
One of the things, again, we know that prematurity and low birth weight contribute to our high infant mortality rates. We know that smoking contributes a lot to those. So we always advise people not to smoke in general, but certainly not to smoke during pregnancy. We want to make sure that moms get early prenatal care. They're connected to a medical provider. So if there is a complication with the pregnancy, or we anticipate a complication with the delivery, that can be worked on in advance and make sure that mom and baby deliver at the appropriate place. Those are some very simple things we can think about.
Yeah, the smoking is obviously something that I know that you all constantly, keep reminding moms. But what would you say to moms overall about their health? What do they need to keep in mind, as they're carrying this baby?
So one of the most important things is for women of childbearing age in general to think about how they are as healthy as they can be before they ever become pregnant. So if you've got problems with blood pressure or diabetes, or you're maybe not physically active, waiting until you get pregnant to fix those is not necessarily the best time. It's a short window, 8-9 months. And so that's not really a lot of time to reverse years of poor health. So we really want the population in general to be as healthy as they can be before they become pregnant, and that's really going to increase the chances of that pregnancy being healthy and that baby being born on time and at a healthy weight.
All right, there are some services like home visiting programs. Can you tell us about some of those things that people might not be aware of?
In all of our 95 county health departments, we've got staff who provide programs like WIC, the Supplemental Nutrition Program, that provides supplemental nutrition for pregnant women, but also infants. In all of those counties, there's also case management services, so folks who can go out and work with families in the home to be able to provide them some basic health information on baby's development, even prenatally to help mom coordinate that care, make sure she's connected with an OB, and has a source of care and a plan for when she's going to deliver.
All right, and most important key point that people can take away from today?
I'd say let's really focus on those ABCs of safe sleep. We know it's about 20% of all our infant deaths. Babies should sleep alone, on their back, and in a crib. Absolutely. All right, Dr. Michael Warren, so nice to see you and visit with you. Thanks for the information. Absolutely, thank you.